Most of the medical establishment treats pain as a failure to be masked. At our center, we view pain as a signal. It is a biological alert indicating that your structure, your metabolism, or your nervous system has drifted out of balance. I am Dr. Pata, and today we are discussing a specific tool to recalibrate that balance. Focused extracorporeal shockwave therapy. We are not talking about the primitive vibration devices you find in a gym. We are talking about high-energy, focused acoustic pressure waves that force the body to initiate a transition from a chronic stalled disease state into an active reparative state. At the core of this technology is Mechanotransduction. When we deliver a focused shockwave, we are not just treating a localized area of tenderness. We are providing a physical stimulus that the cell interprets as a biological imperative to repair. These pressure waves induce controlled microtrauma. This disrupts the chronic inflammatory cycle that keeps your tissues stuck in a degenerative loop. By forcing this change, we stimulate the production of vascular endothelial growth factor, or VEGF, which promotes new blood vessel formation. Increased blood flow means increased nutrient delivery and metabolic waste removal. When utilized as a standalone treatment, shockwave therapy is remarkably effective for conditions like calcific tendinopathy and recalcitrant insertional pain. In these chronic conditions, the tissue is often metabolically dead or dormant. The shockwave acts as an external disruptor. It fragments localized calcifications and, more importantly, triggers the synthesis of collagen and extracellular matrix components. It turns a non-healing pathology into an acute injury that the body is suddenly capable of resolving. We have seen significant clinical shifts in patients who were previously told their only option was surgical intervention. Where the technology becomes truly transformative is when we use it as an adjunctive partner in orthobiologic medicine. Think of an orthobiologic injection, whether it is PRP or cellular products, as the building materials for a house. If you pour those materials onto a foundation that has poor blood supply and chronic inflammation, the uptake is suboptimal. By applying focused shockwave therapy prior to an injection, we prime the biological terrain. We create a hyper-perfused environment that is hyper-receptive to those growth factors. We are effectively prepping the soil before we plant the seeds. This synergy is how we move beyond simply managing symptoms and move toward restoring actual functional architecture. Technology is not a panacea. If your metabolic foundation, your insulin sensitivity, your inflammation levels, your sleep, your nutrition is fundamentally broken, no amount of shockwave energy will fix your underlying degeneration. No amount of shockwave energy will fix your underlying degeneration. It must be integrated into a total system approach. If you are looking for an assembly line injection clinic, this is not the place for you. We are looking for patients who understand that their health is an active, ongoing investment. Pain is a signal. The question is whether you are going to listen to it or keep silencing it with medication. If you are ready to identify the root cause and intervene intelligently, let us look at your specific terrain. Visit us at regen.md. Let us get to work.